Hello, my name is Yamilet Zegarra, and I'm from Family Resource Network. Getting started with your enrollment. Now we're going to talk about what or how are you going to be covered in Get Covered NJ. I have to mention that Marketplace has a really nice and affordable quality healthcare insurance. Most of the time, all of them cover the preventive services, anything that has to do with annual wellness visit or mammography, colonoscopy, things like that. It is important to understand the essentials of the health benefits that you may have if you apply for Get Coverage J. It could be plans that, with any support of the experts or navigators, might help you to understand better how it works, what is your copayment, what's your coverage, everything depending of the type of insurance that you also need and the quality of health that you may have. The enrollment already began November the 1st. And if you enroll until December the 31st, basically your coverage will start January the 1st of next year, 2023. But if you continue waiting until January, which is the last day, is January the 31st, your enrollment or eligibility will start in the next month, February 2023. If you already have any health insurance that you are paying already, and that was done in the 2022, you may actually make sure that, if there was any changes, a life event or anything like that, to make sure that you can continue with your coverage the same way it was, and there was not any life event that might either improve your health insurance or somehow help you to get some benefits also, like financial support. In the case of you are losing your job or you're having an extra income, it is important to let them know, because based on that, your coverage might change, it might benefit. The consumer should have received an update of eligibility notice and will receive a renewal notice also, indicating whether the health plan was automatically renewed for 2022 and 2023, or if there is any changes. Who is eligible to apply? Primary NJ residents. Anyone who lives in New Jersey must apply for health insurance. If you don't know how to, we are here to help you. Please make sure to apply, because otherwise, by the time that you are doing your taxes, there will be some penalties. And the penalties usually is a couple of $100 that you don't want to, lose out of your pocket, or at least your tax return will be deductible from there. Residents of the United States and also U.S. citizens. If not, they must have at least green card. The minimum requirement is employment ID or the employment authorization card and the Social Security. It cannot be, or this person cannot be incarcerated. Requirement information: home, a mailing address, birth date, social security numbers, documentation for legal immigrants if applicable, employer and income information, estimated for the 2022 income, or any policy number for any health plan that you may have. There is a plan for tools to compare, what plans is based on you, but everything is based on your health related issues. It's not the same for a person that have to do treatment every month, comparing a person that just go probably 5 or 4 times a year to the primary care doctor for preventive services. So it is important to analyze that, what doctors are the most convenient for you, who are in network, maybe therapies, specialties and all that. We're gonna tell you about like the monthly premiums. Monthly premiums is just the monthly payment that you're gonna do for that insurance. The doctors that are being covered under that network, and the total yearly cost, right? Financial assistance could be if you are eligible for that. Type of financial assistance. Record levels of financial help are still available. Unemployment recipients. Some consumers receive additional APTC because of they receive unemployment in 2022. This extra saving is not available in 23 under federal law, meaning that it is not longer active. Premium taxes credit will help you to lower your payments monthly. The cost sharing reductions, it will help you to lower all the costs out of pocket, like deductibles and copays. And the NJ Health Plan saving is additional help for people using the marketplace. Under the new American Rescue Plan, more people qualify more for financial assistance. As we mentioned before, there was a window of $51,000 for just one person and 104 for four of them. Now it is more effective and it have a very bigger window where people can apply, even though they get more than 51,000. That's going to be through Get Covered NJ. NJFAMILYCARE is well known also as a, Medicaid and Medicare or CHIP for kids. This is free or low cost. The qualifications are also based on income, and the application can be done also as a one application and Get Covered NJ, and the system will determine whether you are eligible for Medicaid or Get Covered NJ. The Get Covered NJ marketplace, who can help you? Customer call center, or you can always search for a local assistant in your area. The experts are certified and come to you at no cost, meaning that we are certified from the NJ State Department, and we are able to help you, and we don't charge for anything. This is for free. There's some questions that people may be asking, like, what about if I have a pre-existing condition? Well, companies or health insurance companies cannot deny any coverage or treatment or increase your cost, okay? So meaning that if you already have diabetes, they are not gonna be able to increase it just because you have diabetes. All right. What is a switch job in my income changes or household size changes? That's what I was mentioning about the life event, right? A new baby, perhaps you get a better job, or perhaps you lose your job. So all that information, it is very important. Remember, very important to come back and update your application through the year. It is important because you may have more benefits. If you have an extra baby, let's say at home, right? Or you lost your job, then you may be able to get some more improvement with your health insurance and pay less. So it's always important to let them know. Questions? Well, I'm going to be at the Junior Library. You're more than welcome to come over and talk to me in person. Hopefully we can do an appointment and we can register you. This is FRA Navigators, and our contact information is FRA Navigators at familyresourcenetwork.org, and our phone number 1-800-355-0271. Thank you.